Hello, everyone, and welcome to today's webinar. This session is the first of 4 in a new series that we've launched that's focused on strengthening vaccine confidence in Native communities. My name is Alyssa Smith-Longee. I'm Fort Peck, Assiniboine, and Sioux. I'm a public health program manager at NCUIH. I've been working at NCUIH for almost 4 years now on a lot of different initiatives, including our vaccine work. I'm also a registered nurse by trade. I do want to take just a moment. Yesterday was Veterans Day, and so I want to thank those who may be in the room and who aren't for serving, and those who are currently serving. I think most people here know that Native American people serve in the armed forces at higher rates than any other group. My great-grandfather was actually a Sioux code talker in World War II, so I want to give a special welcome and thank you again to those who have served and who are serving and who are in this room today with us. So this session is recorded for quality and improvement purposes. If you'd like to introduce yourself in the chat, please feel welcome to share your name, your organization, any tribal affiliation, and anything else that you want to share with us today. So today's session will kind of be a mix of things. There'll be some knowledge sharing. So I will be sharing out on some of the current respiratory immunization guidance for this year. And then I'll also share some UIO reported best practices and challenges around vaccine programming. And then we'll also have some discussion and polling questions that are infused throughout the presentation. These questions will be really helpful and informative for us as we plan out the rest of these training, so we know what information to include and also how we can best serve. And then there'll also be a survey at the end of this that we definitely hope you'll fill out. It helps us so we know how to improve and make sure that we're serving your organization's needs. So NCUIH does acknowledge that our national office in DC and nearby activities are situated on the traditional homelands of many Native nations. Some of the communities in the surrounding area include the Piscataway, Pamunkey, Nantego, Mattaponi, Chickahominy, Monacan, and the Powhatan peoples. These lands have deep historical, cultural, and spiritual significance to Native peoples. For those who don't know about NCUIH, the National Council of Urban Indian Health is a national representative advocating for the 41 urban Indian organizations contracting with the Indian Health Service under the Indian Healthcare Improvement Act. Okay, so we can start getting started in the good stuff. I do want to introduce the Native Health Protection Network, what you see on the screen here, the community learning series. So this session today is a part of this network. This is something that we've recently launched. It's really designed to help connect those who are working with Native American communities to timely updates and resources around vaccine programs. You can still sign up. It's not too late. From signing up with this, you can expect to receive quarterly emails. So this is an example of the one that went out last week, where it'll share different things around whether there's updates to vaccine guidance. I think we kind of know what we're at right now for this year, but if there is anything that changes there, resources, reminders about webinars and trainings. Again, the polling questions and discussion today can kind of help guide what we put in there, but definitely if you need help staying up to date, please sign up, and that way you'll get access to the future newsletters that we share. Okay, so for the live polling questions, how this will work is we will be using Mentimeter as a software. There's 2 different ways that you'll be able to access this. So Liz will put a link in the chat for you. If you click that link, it should open up the polling for you automatically. If it doesn't, you can put this code in the chat. You can also use your phone. I think that's the way I prefer. It's a little bit easier. So you can just scan the QR code there and it'll pop up the polling for you. Like I said, the questions will kind of be throughout. So we'll talk about some different vaccines. We'll do some questions. If you need to exit out of the polling for any reason on your phone, it'll stay on there. If you keep the window, you can just exit out and do what you need. But I'll also have that QR code on every single one of the polling slides. So if you're struggling to access it, just scan that QR code again, and you should be able to pull it up. And so again, I think if you scan right now, it's going to ask you the first question. about what state or city you're joining from. So we can go ahead and go to the next slide. If anyone's having a hard time, well, it looks like people are accessing it, which is great. If you end up having any difficulty, you can always put your responses in the chat. You can come off mute, or I can kind of try and help troubleshoot with you. But it looks like we have a pretty big span of people. So there's some folks in DC, Colorado, a couple in Colorado, Los Angeles, Seattle. That one was probably me. I'm based out of Seattle. Washington State, yes. I love Washington State. Texas, Virginia. Oh, okay. Trying to think of who might have been able to see the Northern Lights yesterday. Kansas City. Awesome. Well, thank you all for joining. We have a good group of people, it looks like, from all over. Billings, Montana. Awesome. I bet Montana saw the lights. All right, you can go to the next slide, and you can keep putting stuff in the chat, and you can keep responding. So for the first question, we'll go ahead and just kind of start off with like a general select all that applies. So if any of these apply to you, feel free to apply or select them. If they don't, you can put them in the chat. Again, this is also not just me talking. So if there's something that you want to share throughout this, it could be a story, it could be something applicable to this. Don't be shy. But for this one, we're asking what factors, if any, affect vaccine services at your facility. So that could be patient transportation. Are your clients having a hard time getting to the facility so they're not able to get the vaccines? Are there staffing shortages? That could look like appointments. Maybe you have folks who there's just not enough appointments, and so you're not able to get those vaccines. Supply issues. Are you receiving the vaccines to give? I know and I still work as a nurse, and we've had a hard time with the COVID vaccines, so nobody's really giving it. So that's one that we've kind of seen. Storage challenges with all these different vaccines, they have different requirements. And so I see a couple people said other. If you want to share, that would be great. You can put it in the chat, or please, you can share out loud. I'd love to hear kind of what else that's not represented here that you're experiencing. Stable billing system. Okay, that's good to know. So you're not able to bill for, are you administering the vaccine still, and then you're not able to bill after? Is that kind of what you're experiencing? And Emily, you can feel free to respond. Dr. Fowler, so I'm also joined by one of my colleagues, Dr. Fowler. She's our VP of Technical Assistance and Research. I was curious if you wanted to share anything you've been hearing around storage challenges.
Good afternoon, everyone. Yeah, I kind of hearing from some of our urban Indian organizations that are having some storage supplies. The things that have, or one of the things that has come up is the ability, and this kind of may hit on what was shared by not have a stable billing system, but not interestingly, it's on the distributor side, and that they may be reluctant to allow a facility FQHC to purchase vaccines because they're not sure if they're able to cover them through the coverage of their patients, especially with some of the recommendations that were a little fluid and not understanding if the coverage for administering the vaccine would be covered. So it's kind of interesting because it was more so on the distributor side, but it impacted the facility because they then aren't able to provide that vaccine, or they had to do, a little more pushing against the distributor to make sure that they can ensure that they were going to cover or pay for those vaccines up front. So I don't know if any of you have experienced that or are seeing that occurs with some of the unknowns around insurance and the coverage of vaccines itself too.
Yeah, thanks, Dr. Fowler.
Yeah, so I think that's, now that I see Emily's message, yeah, I think it comes around that, like not being able to bill for the private insurance that might be covering it, but if you're purchasing direct from the distributor, that is the vendor, the vaccine maker.
Yeah, that is a good point. I know this year has been especially challenging since there's been a lot of kind of changes with the shared clinical decision making, and so a lot of uncertainty with that. I'll pause one more time to see if there's anyone who wants to kind of respond to what you shared, Dr. Fowler, and if not, we will keep moving along. All right, perfect. So now oh, sorry, go ahead, Justin. Oh, did you come off mute on accident? No worries. Okay, we can go ahead and continue. So we'll start talking a little bit about some of the seasonal respiratory immunizations that we're going to see this year, and sort of the updates. So we'll start with the influenza or flu vaccine. Not too much to share on this. This has been, pretty steady through the years, but the annual flu vaccine continues to be an effective way to prevent serious influenza illness. It's recommended for all persons 6 months and older. That includes pregnant people. It's really rare cases that it's not recommended. There's a lot of different vaccines available, and so I won't go into all of them. The CDC does have on their website sort of a list of all the different products. This year they're trivalent vaccines, so they're covering the three. And then I did want to just kind of, for considerations, highlight the influenza live attenuated option. So this is a caregiver administered option that can be done. I think it was approved last year, if I remember. So it's like a nasal spray, but just to note that this one is not approved for pregnant people. And so I did want to highlight that, since that's kind of a newer option that we're seeing. So we'll spend a little bit of time on the pneumococcal vaccine. So pneumococcal, it's unique from the other illnesses that we're talking about today, since it's caused by a bacterial infection. So that can cause a range of infections, including pneumonia. The 2025-2026 season, it is including a broader coverage of recommendations. So now 50 instead of 65 years and older for adults is recommended. And then for children, it continues to be that younger than 5 years. And then for the risk-based recommendations, it's the 19 to 49-year-olds, looking kind of at the specific options. So among those that have been approved by the Advisory Committee of Immunization Practices, you'll see me say that, ACIP, there's the PCV 15, PCV 20, PCV 21, and PCV 23. PCV 21 provides the broadest coverage. However, the IHS did update their region-specific guidance for those areas, and I think we have some folks who are from those areas today here, where serotype 4 circulates more. PCV 21 actually doesn't cover serotype 4, and so the preferential use is PCV 20. And in the next slide, we'll take a look at the IHS recommendation that they released this year. The National Pharmacy and Therapeutics Committee released this formulary brief. We'll put the link in the chat there for you. So essentially kind of what they're saying is, in the geographically targeted vaccine selection in those regions where there's a higher prevalence of serotype 4, so that's Alaska, Colorado, the Navajo Nation, New Mexico, and Oregon, that preferential use of the PCV 20. They do still recommend PCV 21 in the lower prevalence areas, and they go into it a little bit more on the brief. On this brief, there's also a link to a job aid around pneumococcal vaccines and kind of catch-up times. I know the timing for this one can be a little bit tricky, but we'll share those with you in the chat. And then for the COVID-19 vaccine, I know there's been a lot of discourse over the months around this. So to kind of just keep it simple, kind of where they landed on these recommendations. So 6 months to 64 years old, it's recommended based on shared clinical decision-making, or that individual decision-making, really in this age group, putting an emphasis on those who are at risk for severe COVID-19. And then the 65 plus group, again, still based on shared clinical decision-making. I did want to kind of call out a couple of key updates that we saw in the vaccination schedule, particularly around the products and age groups they're approved for. So for children ages 6 months to 4 years, Moderna Spikevax is the only one approved for use. So previously Pfizer was approved for under 5, which they are no longer authorized for this age group. So that is something I wanted to share. The Novavax COVID-19 vaccine is approved for people ages 12 years and older. And then the Moderna Next Spike COVID-19 vaccine is approved for people's ages 12 years and older. There's definitely a lot of kind of different nuances with that. So I definitely recommend visiting if you want to go into it a little bit more, visiting the CDC site. Okay, so for our next question here, kind of piggybacking off of what I just mentioned, especially with COVID-19 vaccine, a lot of information kept coming out kind of just back to back to back. It was really hard to know, what's true to really stay up to date. And so I'm curious, with this response, you're able to just type into the free text response, but how is your facility or yourself staying up to date with all the changing recommendations? I know, like for myself, I try to subscribe to different newsletters as one way. The state health department, that's a really good way to stay up to date if your health department is good at updating. Insurance companies. Oh yeah, that's true. I never thought about that, but you'll see a lot of the different, for example, ACOG, which I'm now forgetting, but it's APA, the American Academy, or AAP, American Academy of Pediatrics. I can use that one. They'll often share also kind of like what's going on and sort of their recommendations as well. Yeah, professional medical organizations, immunize.org, that's a really great option. The local health department, Vaccinate South Dakota. Has anyone had a hard time finding ways to stay up to date? I think for me, I had a hard time just knowing like what was true that I was reading.
Yeah,
Maintaining
I
this.
had a hard time because there was like discordance between the FDA and the CDC, and then the government closed before everything really got hammered out. So I've been leaning on the professional medical organizations a lot more as well.
Yeah, thank you so much, Justin, for sharing that. I know, I think we shared this resource in that newsletter that we released, but I'm forgetting who might have been immunize.org actually. I can't remember who released this, but they did exactly that. They created kind of like a crosswalk where you had the CDC, ACIP recommendations, and then they included on there what the organizations are recommending. So for example, I think COVID-19 vaccine is currently not recommended in pregnant people by the ACIP, but like I said, ACOG continues to recommend it. So it was really helpful because I agree. It's like you see so many different things, and so it's difficult to kind of know what to follow. Okay, well, we can keep moving along. Thank you for sharing that in the chat, Justin. So we'll spend a little bit of time on RSV, or respiratory syncytial virus. With this table here, we'll look specifically at the adults. So for those who are ages 50 and over, the age group of 50 to 74 is specifically recommended for those who are at an increased risk for RSV. And then the RSV vaccine is recommended for everyone ages 75 and older. Looking at pregnant people, so for babies, they can receive protection through 2 different modalities or 2 different ways. One is through maternal antibodies. So if the RSV vaccine is given during pregnancy, those antibodies can pass along to the baby. I do want to, I think it's written on here, but highlight that Abrysvo is currently the only approved vaccine for pregnant people. But if they don't get it during pregnancy, then another option for the babies, for those who are under 8 months and are entering their first their first RSV season, which you can see here is typically October through March, it's recommended that they get a dose of the RSV antibody. So this is also through an injection. It's for all infants 7 years or 7 months and younger. And so I wanted to kind of highlight also the 8 to 19 month age group. So for those kiddos, if they're at an increased risk, oh, sorry, you can go back one more slide really quick. For those who are at increased risk, it's recommended that they also get a dose in that second season of RSV. And I want to highlight that all American Indian Alaska Native children actually fall into that bucket. And so you can go, sorry, to the next slide now. Just to kind of break up the pediatric ones a little more specifically. So on that left here, you'll see, again, all infants 0 to 7 months in that first RSV season should be getting the RSV antibody protection. And then infants, if they did not receive it through the maternal vaccine, just to remind you of that. And then for the infants and toddlers, 8 to 19 months who are at risk, they should be getting that dose as well. And again, that's all American Indian Alaska Native infants. RSV is the leading cause of hospitalization among infants. And so we've seen a lot of success. The nirsevimab product they've been able to do studies on this one to see that it's been really successful in reducing hospitalizations. And so this year, this season, the nirsevimab is the IHS preferred option, since there is that real world data showing that it's been effective in Alaska Native children. The clesrovimab, I don't know if I'm pronouncing that one correctly. It's a new product this year. It's not approved for the 8 to 19 month, which is one of the reasons the IHS is preferring the nirsevimab, since that includes all Native children. There are just kind of a few things I want to bring up with the nirsevimab. It is a weight-based dosing, so you have 2 different options based on the weight of the infant or toddler. And then clesrovimab does not have that weight-based dose, so it's a little more simplified in the dosing. But again, like I said, there isn't that real-world data yet, since it is a newer product and it's not approved for the 8 to 19 months. Typically, the antibody will provide around 5 months of coverage, which usually covers the typical RSV season. I do want to note that in some locations, RSV can have a unique circulation pattern, for example, in Alaska. And so those regions might change their recommendations based on, how much of the virus is still circulating. And then lastly, on this point, I wanted to highlight the careful attention to specific storage and handling, since that can, with all vaccines, you have to pay attention to this. But I know with the RSV vaccine, there can be some that you have to kind of watch out for. So that will lead us into our next question, where we are going to talk a little bit about the storage and handling. This one is just a kind of simple, let's set the baseline of how confident your team is in managing vaccine storage and temperature monitoring. If you are the team, you can, of course, respond for yourself. But when you have a lot of different products that you're handling, I know sometimes it can be a little tricky. And again, if you popped out of because we went away from the polling, if you popped out, you can scan the QR code again and it'll bring you back into it. Or if you just open the browser on your phone, it should still be there. So it looks like most people are feeling pretty confident. I'll just give us a couple more seconds here to see if anyone else wants to respond, and then we can go into a little bit more. Okay, we can go to the next question. So this one is open-ended. I said challenges, but it sounds like some of you all are actually doing pretty well. So if you also have, something that's working for you in terms of the storage and handling, feel free to also put that in your response. But the question here is, what storage or handling challenges have you encountered with common vaccines like flu, COVID-19, RSV, pneumococcal, or any other childhood immunizations? I know I've heard in some conversations, I think this was last year, at one UIO, they had the RSV vaccine, but I don't think they were really administering it. And so I'm not sure what ended up happening. And I've heard from some UIOs that they've had to throw stuff away before. And so I'm curious if anyone's running into this kind of challenges. How do you all manage? So for example, if you have one that requires the thawing, how do you remove based on appointments, or do you kind of have a inventory that you keep based on what you're administering? Justin, I might call you out and see, since you've already spoken once, how are you all doing with that? Do you pull vaccines based on like appointments that you have, or?
Yeah, so actually, we're not getting the frozen ones this year from the NSSC. We had some last year that we got from Henry Schein, but I would keep basically, depends on how busy I am, but I would like keep one thought out or two just in case and then I would also pull for based on appointments, but because we would do walk-ins and stuff, people would come in for the food pantry or some other reason and then decide to get vaccinated. And I found that if I told them, well, you have to wait 30 minutes or I could kind of stall, and if the room was warm enough, maybe, but it was better just to have one ready to go because once you start saying, "Oh, well, you're gonna have to wait for us to thaw it out or come back another day," then you lose them. So,
Yeah, that's really interesting. I know, like for me, where I used to work, what they do is they would like roll around with a food cart, and so they keep us there because it's like there's food, so people would stay. And I know, like I've heard people do events and things like that to get them. But that's interesting. I saw that someone here said for COVID they keep one in the fridge thawed, and we also pull based on appointment. So very low RSV administration rates. Yeah, I heard that last year as well. I'm not sure who responded. If you're comfortable sharing more, I'm curious, is it based on, do you feel like awareness? The community members just aren't aware, or they're not interested in it, or you just don't have the correct population presenting who is indicated for? Awareness and hesitancy. I think maybe it was that person who responded to that, but we'll talk about it a little bit. I think I have this as a bullet point to talk about, but I think especially with RSV, it's important for community members to understand the disease burden. It really impacts the elders and the babies. So I think helping them understand that is definitely something. But this is a challenge that I've heard too before. It's hard when you're trying to push 3-4 vaccines on one person at the same time. It can be hard to do that because then it's okay, well, you need flu, you need RSV, you also need your COVID and your pneumococcal. And so I've heard that as a challenge among facilities. Not enough pregnant women at our clinic. Accidentally giving adult COVID vaccine to a child. I've heard that happen. I know with the RSV, like I mentioned with nirsevimab, there's a weight-based dosing, and I think they had some issues with that last year. And I'm pretty sure they addressed it with some of the color coding. Do you feel that was the accidental administration was kind of was it more of a handling issue, or how they were stored? And Justin, we used to carry Abrysvo, but we didn't have any opportunities to administer in pregnancy. This year we have Mersivia, but many of our eligible folks have had it already. Right. Thank you for bringing that up, because I did forget to mention with RSV, it's not an annual vaccine. So it's at this time, it's currently a one-time dose. So thank you for kind of mentioning that. And that's interesting. I know the IHS has kind of mentioned that they've been seeing Abrysvo a bit more just because it is applicable also to the pregnant population. But if you don't have a large community that it's relevant for, then I can see where you would try a different product. Wasteful to throw away and too hard to do so many vaccines during a short time with patients, if not at a mobile clinic. It's understandable. We can't get reimbursed if we can't use it. Mm-hmm. This is all really helpful information. And again, if any of these, like I said, if you have best practices to share, that's also encouraged. Is there any final thoughts on this question before we move along. Yeah, I saw a thumbs up, so I think we can go ahead and move forward. All right, so to kind of summarize what we looked at, this is just a table that goes by the different vaccines and then the different age groups. And so we won't cover it all again, but again, like I said here, I'll just highlight that column with pregnant people and COVID-19. It's currently not CDC recommended, however, it's still recommended by ACP, ACOG, AAFP. And so that can get a little bit tricky, definitely. And I think that's when the shared clinical decision-making and those conversations with the providers really come into play. Okay. So we can go ahead and move forward. So now we'll just talk a little bit about some of the challenges. I know we've already been doing this throughout, but this is what we've been hearing from UIOs kind of around their vaccine programs and challenges they've been having. Vaccine burnout is probably what I hear the most. That was kind of brought up a little bit in that last question, where you're pushing so many different vaccines, and that's not just with the community members, but the staff members as well can feel that vaccine burnout. So I think that's something that we've all been really trying to work on and work towards addressing. There's the misinformation, mistrust in the effectiveness, fear of side effects, lack of awareness, the receiving of supplies, which it looks like we saw today that still seems to be a challenge. And then funding for Native-led vaccine promotion events. This one, from what I've understood, I mean, we've seen through the COVID pandemic how successful tribal communities were at vaccine campaigns and getting their community members vaccinated. And so getting that funding for the the people who are in the community, boots on the ground, to be doing these promotion events is something important, but I sounds like there's been challenges in getting funding for that specifically. But we can go ahead and we'll open it up now to the floor to see if any of these resonate with you and you're also having those challenges. Please put them in the chat, and then, or sorry, in the chat or in the response box. And then if there's something new that wasn't on that slide, I'd be interested to hear about. I'm definitely curious with the shared or clinical decision making. Has that been something? I feel like as a nurse, like something that's always been done is we communicate, with our patients and make sure they understand the risks and what they're doing. But I'm curious if this has had an impact at all now that it's become more of a recommendation as well. So if there's anyone who has anything on that to add, I'd be curious. Transportation. Yeah, this one it's definitely a challenge. No more COVID money to promote vaccines anymore. So how are you all promoting your vaccines? The flu clinic is successful. That's great. We struggle with comms that will attract to our vaccine events, typically on social media. Yeah, social media is tricky. I am not good at it, and we have the person running the slides with us today who is good at it, luckily. But it's hard to reach because you're trying to reach different community, age groups, and you want something that appeals to them and draws their attention. Social media and misinformation, having to give out free food or t-shirts. Yeah, incentive programs was one of the best practices that I've heard tend to work. Finding ways to bring in without monetary incentive. Yeah, I think with that, that's where like I said, that disease burden and understanding really comes into play. I think like one strength with Native American communities that we have is that we are so accountable to our community, and we want to protect our relatives. So that's definitely a point I always try to remind, what is the purpose of these vaccines? Some of them are protecting, yourself, some are for protecting your community. We love your RSV toolkits. Oh, I'm so excited. Yes, RSV is very, maybe you heard me say kiddos. I'm a pediatric nurse, that's my specialty. So RSV is something that I've seen a lot, and I worked in it before there was any protective options for them. And so I'm excited that you all are using it. I think these options for babies is a newer thing. And so we need to make sure that community knows that it's there, that Native children are, I think it's 4 times more likely to have hospitalization. I can't remember exactly, but how have you all been communicating different updates around COVID-19 vaccine? Has that been coming up a lot in appointments or in conversations? And remember, you can come off mute. Confused patients on COVID rules now. Yes, I think this has been very confusing. Dr. Fowler, I might see if you have anything that you want to comment on that might have been shared already.
Thanks, Alyssa. Yeah, I'm just thinking through it. I know that definitely that issue around not having the funding for the marketing and outreach is definitely something we're hearing. And I think that's broadly just generally across probably all populations right now, in getting the word out and finding ways to encourage people to come in for the vaccines. I know during, a few years back, I think a lot of our UIOs really utilized when they had, events to use that as a space where people that are already there and maybe doing something fun on the side, whether that's during your holiday events, where they might be able to take that space and get vaccinated or immunized for anything. So I liked the idea, Justin, that you shared around making sure that there's, vaccines that are thought and available, but, keeping in mind that when you're having those events, that would probably be a good time to do that kind of approach. But I think it really is hard with all of the misinformation that's out there too as well, and still trying to combat that without the means to do so. So I think just having those even as providers, having those conversations with your patients, even if it's just, a small touch point at their check-in, just to state that, so that maybe that, resonates with them later on. And when they come back, they might want to do so. So I think we just have to continue to encourage our patients in our community that these efforts are really to promote their safety and the whole community safety.
Yeah, thank you, Dr. Fowler, for kind of going into that. I completely agree with you. And I saw that, Alicia, you had put how your families really don't want to talk about COVID or the illness or the vaccine. And I saw someone else put hesitant to talk with us, so we move on. And I completely relate to that. And it's something too that I've been thinking about. And, you're in this appointment, you have all this stuff that you're trying to address, and you're not wanting to make a rift in the rapport. So, you kind of just move past it. But like you said, Dr. Fowler, I think it's even just like, well, it's a moment to educate, like, these are the options, this is why it's important. And maybe the next time they'll think about it, come back and do it. Is there any more thoughts on challenges? Give it another second, and in the next one, we'll talk more about best practices that we've heard or kind of suggestions. Community has strong testimony as we lost several elders in the last season. Thank you for sharing that. I think that that's definitely what hurts and hits to home, is when we hear those stories. And I wasn't able to attend this session, but River, our person behind the screen, was able to attend a session on flu. And the person presenting, I don't want to speak wrong, but I believe they lost their daughter to the flu. And I think there was something around the vaccine. I don't want to tell her story wrong, but that's what hits the hardest. We'll continue this conversation into the best practices. So these are some things that we've heard from UIOs that seem to either be working or they think are good suggestions around how to kind of improve or address some of the stuff that we talked about. And so one of them is having vaccines readily available with statistics on the benefits and the effectiveness. I think that's what I was really excited about with the nirsevimab is, like I said, they do have they released a study that was done with the Alaska Native community, so they know that this product is effective for Alaska Native children and reducing the severe RSV. So I think that that's definitely important, especially when we're dealing with the hesitancy part. And then those education efforts to the community, it was talked about a little bit. I know a couple of you brought it up around social media. We have quite a few social media toolkits. I'll share our RSV one here soon. Definitely, if you're having a hard time, creating your own products, not everybody is a designer. Definitely try and look for those because I think they can be really helpful. You just move them onto you can copy over, they're ready to go. And so I'll show you that a little bit here soon. Having brochures and then culturally relevant printable and digital media materials is what I hear a lot. And I couldn't agree more. We need things that we connect with, and the community members need to be able to connect with the stuff that's put in front of them. So it's just an example from our RSV toolkit. This is actually out of UIO, a little baby getting ready to get their vaccines. And so I think that that's a really important part when you're trying to connect. And then Mythbuster fact sheets, mobile vaccine clinics, or vaccine events. Sounds like that's been pretty successful for some of you. The vaccine incentive programs, I know that those can be trickier because you obviously, if there's an incentive, there needs to be funding for whatever incentive you're providing. And then finding ways to express support and empathy to patients and community members. I think this one's important when we're dealing with burnout, just kind of having that awareness. And then community awareness of the disease risk and burden. And by that's what I was kind of talking about, where if there is hesitancy, for example, with RSV, helping them understand, well, why do you even need this vaccine? What does it do? Or if it's for the babies, it's not a vaccine, but an antibody. So this is kind of some of the stuff that we've been hearing. And so now I would love to hear if any of these are similar to what you suggest or what you all are doing. Or if you have something completely different, you can start to share here. I know, Dr. Fowler, you talked a little bit about doing something fun on the side. And I know one UIO had shared that, I don't remember if this was for vaccines, it actually might have been for something else, but sometimes they'll do something like a cultural activity night where they'll be prepared to do, pizza party and fry bread, food. Always a good one. But they do I think they did basket weaving, and then they in that had some education, woven in around these protective measures for their community, and then having that ability to get vaccinated that day if they chose to. I think there was about one, I can't remember who shared what, but I know I heard about a basketball tournament once, which I thought was a really creative idea. Mobile clinics, those are great. I'd love to hear more about, are any of you, so it sounds like some of you are doing mobile clinics. Are some of you trying to do them, but having a hard time? Because if there's anyone who's wanting to, I'd love to hear from those who currently do it on kind of how that looks. A Halloween flu drive, that's a really good idea, actually, because you're right at the prime time to start vaccinating. And art market worked better when we had incentive gift cards they could use with the vendors. You're all doing a lot of really creative stuff. Local grocery always donates sandwiches and water for our events. Don't be afraid to ask for donations. That's a good idea. I know a lot of just thinking like CVS, they'll give you like 10%. So that's a good idea to reach out to them. when you do these events, how do you promote the vaccines as well? Is it like a vaccine promoted event, or you kind of say, oh, we're doing pizza and this? How do you include the vaccine part into it? Does anyone want? I don't want to call anyone. I'm not good at calling people out. Does anybody want to come off mute? I'm curious, like how you incorporate the vaccine part into some of these events.
When we were able to access incentives, we would definitely advertise the incentive in our social media and marketing. And we, for the art markets, we had like artist spotlights that would come out kind of leading up to the event. But then there'd be just a little blurb. It wasn't like too much in your face, kind of to the side, about how we had an incentive for the vaccines. And if we don't have incentives, we try to put that you can get your vaccine there. But we don't try to make it like the main focus per se, because we don't, we want all the people to be there, and some folks who have made up their mind, but still we want them to participate. So
Yeah, that's a good point. I agree. It's kind of and you're not forcing, it's not required to attend. They can attend and not do it. But Amy said, we offered free flu shots for all the community along with vaccine educational handouts for new moms to be. Oh, that's a great idea. And I saw about the community baby shower, and a unity in the community offered STI testing as well, and free swag. That's a good idea to kind of incorporate multiple things into your events. It's hard when we can no longer do monetary incentives. I understand that. I've been trying to think of like how there's how to do other ways to still get folks to come. But thank you for sharing that, because it's good to know and something to think through. No, nobody spoke on the mobile clinic. I'm so curious about the mobile vaccine clinics, because I feel like they're so impactful, but it can be a little bit tricky with the logistics of it.
when we go places, just a quick call out, we use something called a cool cube. And it doesn't look very fancy, but apparently it's all very fancy and vacuum sealed panels and stuff. But it is like $800. But if you ever come across one of those kind of like low grab grants where it's like, I could write a grant on this, but I don't know what I'd do with it. It's something to keep in mind.
What is that? I actually don't know what a cool cube is.
Oh, I'll show you if I can go on video. Uh, so it's this here, Cool Cube 8. And then inside here, these panels they look boring, but they're some kind of high-tech vacuum sealed material. And then inside of there, you put ice packs that you've like prepared, frozen a certain way or whatever. And then we had an event the other day where I sent some vaccines with our medical director, and then he gave them all. And when he brought the cube back 4 days later, it was still at 5C inside.
Wow.
We wouldn't have pushed it so far if we'd still had vaccines being stored in it, but it just happened to still be that cold. So
Wow, that's awesome. Thank you for sharing, Justin. It looks like Amy says they have those as well. They're wonderful. Was there someone who was coming off mute?
Oh, that was me. Sorry. I was just
Oh,
wondering about is the inability to do monetary incentives, what is the reason you can't? Is it because you don't have the funding for it, or is there an actual restriction happening? Like, from your grants or the federal government or?
Just our tribal leadership doesn't want to do monetary or I guess swag items anymore.
Okay, super helpful. And I think COVID dollars had given additional money in the past, but and so I think that's what some people were doing, but that makes sense. Thank you, everyone.
Yeah, I can understand too. Maybe some feel like could it be not persuasion, but it's more like encouraging people for their time, they take to come to it. So that's helpful. Thank you for sharing. Anything else? We'll have one more question after this about future topics, but I'm glad that the Cool Cube is getting a lot of sounds like good stuff in the chat. So thank you for sharing that. All right. Well, as we kind of close out the polling part, like I said, a lot of this is really helpful because it knows what we can include in the future trainings for this series, but also around the Native Health Protection Network, just our newsletters we send out so we know what to include. And so with this, I'd love for you to share any topics that you'd like to see in future sessions. This is a select all that apply. If there's a topic on here, if there's a topic that you want to see that's not on here, then please put it in the chat. And that way I can take note of it as well. I know we're thinking of the one here, the social media one, I think is a session we're considering. And so it'd be definitely helpful to know if that's something of interest. So I'll just give it another minute or so. Wow, it's about 900, but it seems, it's worth it, especially if you're doing these on the go. Sorry, I was looking at the Cool Cube. If you have anything that comes to mind, feel free to put it in the chat. And then if it comes later on the survey, there's an option as well to include future topics. But before we transition into sharing a few resources, I just wanted to open the floor one more time. If there were any questions about anything that we talked about, or if anybody had any comments. All right, well, perfect. Thank you again for doing the polling. I'll share just a few resources before we officially end the call. So this is the RSV toolkit that we were talking about earlier that we just launched. And so this is kind of a look at some of the products that are in it. You can go to the next slide. So what you'll find here, there's printable posters. So the one on the far right is an example of that. So you can print those and hang them around your facility. There's two different types of social media graphics. They're illustration versions. These are storyteller figurines, and on the website we talk a little bit about this design and kind of the inspiration behind it. And then there's also on there the social media copy, so you can just take an image, put it on your Instagram, for example. You can use the social media copy if you would like. You can create your own, you can adapt, and there's also newsletter options. And so these are ready to start using. I think Liz put that in the chat for you if this is something that you want to start sharing on your platforms. But they are ready to go. And in the next slide, I can just show you kind of what it looks like. So for example, this is Denver Indian Health and Family Services who shared out on their platform, and then OKCIC who had shared the nurse storyteller. This one is the elder storyteller. So each one's kind of telling a different story about who they're protecting through the RSV vaccines. Definitely start using it. This is a podcast that we had done, Dr. Fowler and myself, where we talked about COVID-19. So something, if you're interested in taking a listen, you can. And then we do offer one-on-one technical assistance for member UIOs. I always like to include that here with the link. If anything from this conversation struck something that's you want to go deeper into, if you have another topic, feel free to submit. And you're gonna get a lot of links in the chat right now. And then just a couple announcements. Our newsletter for the organization wide is, always subscribe to that. That's how you can stay up to date, especially in a lot of our policy information. So please sign up if you haven't already. And then we do have some upcoming events. There's one next week, a really exciting event. If you can join, it's on narrative therapy and looking at storytelling as a path to healing. There's another one in December, which looks at SMART objectives and logic models. This is really helpful, especially in grant writing. And so I know right now probably a lot of folks are doing that kind of things and securing funding. So this is definitely an event that you would want to attend. And then our annual conference registration is open. The dates are set. The call for proposals actually went out last week. And so we're now accepting those if there's something that you wanted to present on. And so you can take a look on our conference webpage. And then this month is National Diabetes Awareness Month. So I did want to call out for that. You'll probably see stuff across our platforms promoting this. And that is that. So thank you all again for joining and for responding to the polling questions. Really helpful. It sounds like you all are always doing a great job. And so I'm glad that we could come together and have a space to kind of share and bounce ideas off of. The survey, I think for some reason, the one in the chat, Liz, if you could share one more time, I think the H part got cut off, but you can click the link in the chat for the survey or you can scan it. We will also send it in a follow-up email if you kind of rush off today and don't have time. But again, it's really helpful if you can fill this out so we know how to improve our events. But we will go ahead and stay on this slide to give you all time if you would like to do the survey now. But otherwise, thank you all and have a great rest of your day.